So I was listening to this, I was reading this comment, and a commenter basically was saying that her boyfriend was deaf, and he was deaf because of forceps. So you know when a woman is giving birth, and sometimes instead of using their hands to pull the baby, twist it, they'll use like forceps to pull the baby, like these giant spoon thingies they pull the baby out with. And she was saying that he was deaf because of that. And I was just like, I got so mad, not at her, but I was just like, God damn, is there anything that allopathic like medical industry has not just like destroyed or broken? Like, is there anyone in any way? Like, I just, like I said, if I get shot or stabbed, take me to the hospital, not Babaluka, the medicine woman, but any other situation, I'm going to Babaluka. If I had kids, I'm having a home birth, okay? I've heard so many stories by now and seen so much evidence of just how detrimental the allopathic medical industry is. And I'm just like, with all the people that they kill and injure and lives that they destroy, them being the third leading cause of death and all, and that's very true. I'm going to leave links in the description from mainstream sources that even admit that, okay? Medical error is the third leading cause of death. I think they have their place with trauma, but even then, I'm reluctant to go to the hospital because they don't use critical thinking, okay? And it just got me, and when I was reading that, I was going on this internal rampage because I was like, one of the places I deliver to is a heart clinic, and they have their patients wearing masks. And I'm like, why do you have your patients wearing masks if it reduces their oxygen intake? That's going to make their heart problems worse, okay? Why are we wearing masks anyway? Because if you had common sense, you would know that you can't contain a virus and that these masks don't protect anything. That's one. But not only that, you're having your heart patients wear masks that drastically reduce their oxygen intake while they have heart problems. I was just like, it's like, I was looking at this cancer documentary and on alternative methods to cancer called The Truth About Cancer. You should see it if you haven't, okay? But one of the doctors, he has healed many people from cancer naturally. He's, I think they call it an orthomolecular, I'll just say he's an orthomolecular doctor, okay? And he was basically talking about how cancer, sugar feeds cancer. And the interviewer was like, well, doctors must not know this because when I go, when I've gone with my relatives to chemotherapy, there's sugar and candy and cakes. And when I went with my aunt's chemotherapy, I was pigging out. It was amazing. Ice cream, cakes, ice cream bars, sugar, right? So the orthomolecular doctor was like, well, yeah, they know. And he's like, how do you know that they know? And he's like, well, when you get a PET scan, which is, I guess, some kind of a scan that determines whether you have cancer, they actually inject you with radiated sugar. And the cancer cells light up because they eat the sugar and they light up. So you see like the whole test is based upon radiated sugar. So you inject the solution to people and then you get to scan the solution radiated sugar. And then you know where the cancer is because they light up and get all happy because they're feeding off the sugar. And that's how you know where the cancer cells are. So I'm not saying that doctors and nurses, I don't think that they're malicious. But they're clearly just brainwashed and they don't use their critical thinking skills and their type of education, which is basically memorizing and regurgitating, is, pushed to this left side of the brain where they don't have whole brain thinking. So even though that's something they can probably tell a patient, they're like, yes, you're going to get a PET scan and we're going to inject you with radiated sugar. But they're not going to make that connection that cancer feeds sugar. Like they don't have the whole brain thinking. And that's what's the problem with the medical industry. They're probably like, well, this woman is having trouble giving birth. So we're just going to get these forceps and basically crush the baby's ears in. And that's gonna, help bring them out. Like, why don't you like relax the mom, right? Why do they give birth in stirrups? They actually should be giving birth like on all fours or laying down or in water, Like you look at these third world countries where women have babies all the time. They're like, oh, I'm about to have a baby. They like go to the lake. They're just like, they have the baby, they're done. And they're fine, right? And, we have the highest infant mortality rate as a first world country, and we give vaccines. We do shit like forceps shit. We have cesareans. We, do all of the unnecessary cesareans, by the way. Maybe there's a case for, emergency cesareans. I'm not judging people that have had cesareans. My cousin had a cesarean. I've known many women that have had cesareans. I'm not judging you, okay? I'm just saying that they're so ill-informed that they, people plan their pregnancies now. They're like, oh, well, if the doctor's like, well, if the baby's not born by Wednesday, we're just going to go make an appointment and cut her out anyway, right? And now all these women they have to always have a cesarean. They can't have a vaginal birth after they have cesareans. And they also it weakens your uterus. It's terrible. You're cutting into yours. My cousin, it was funny because I was telling a friend this and my friend thought I was full of shit. So I had to call my cousin on the phone in front of my friend to get my cousin to confirm. And this is at Cedars-Sinai, mind you, which is one of the most world-renowned hospitals, okay? I was born there. My cousin was born there. And she was basically saying that, like, when she had her cesarean, I'm like, it's not funny, but you're just like, what? They basically just like threw her intestines on a table and just pull the baby out and then just like stuff them back in. And my friend did not believe that. She's like, they didn't. And I told somebody else. I mean, he was like, wait, so they didn't like fold them back in? Like, no. I'm like, they just threw them at, like, they don't give a shit. Like, literally, like, I mean, it's just unbelievable. Even when I go make a lot of these deliveries, I have a pass to get in certain areas. I'm not like important or anything, but you're allowed certain access to certain areas. And I've gone and made deliveries to certain areas where people should have asked for my pass. And I swear within a year, the year that I was working there, like only maybe 2 people asked me. And I was like, if I was a super secret ninja assassin that was trying to sneak into the hospital and like, assassinate somebody, it would be pretty easy. It would be pretty easy. Because, you just act like you're there to do stuff and nobody questions anything. And a lot of these nurses or doctors are on drugs, like, prescription, legal drugs I'm talking. I'm not even talking, probably illegal drugs too, some of them. But I'm talking about legal drugs like, they work incredibly long hours, like, 14-hour days or more minimum, okay? And then they're on stimulants, they're on caffeine, which is bad for your brain. And then they're also probably take stuff to help them go to sleep. And they're worn out and they're tired. So they're susceptible to programming. They're susceptible to just, a lot of them are just probably like, oh, okay, I'll just do what I'm told. Because they don't have the capacity to think. They don't have the stamina, the strength to think. So they're just kind of like automatons. Not like, I'm not dogging them. I know, I will say that I think the nursing field in particular, I have other theories about doctors, but the nursing field in particular really draws a lot of very, really nice people that want to help people that are people to the field. I think, people that enjoy taking care of people. So I think, initially it draws good people in, but I think the system just really like messes a lot of these people up. And then doctors, I mean, the hierarchy, they're just trained to think that they're better people, and they can't even make simple, critical, elementary connections, okay, that you can make to certain situations, even though they know that somebody that has a heart problem shouldn't be breathing in a reduced oxygen environment. They're going to be like, wear this mask, it's going to protect you. Even though it says on the box that it doesn't protect you from COVID-19, you should wear it anyway because I said so, because I'm a doctor. And the other doctor said so, and the people at the top told me to, So, I mean, I had one of my girlfriends, my ex-girlfriend, we're not friends anymore. It's another video, but her husband was a surgeon, and she would tell me that he would go into surgery drunk, right? He would go into surgery drunk. He would drink, be drunk, and fucking go to work and do surgeries on people. Okay? So, I mean, I've had enough experiences with doctors, good and bad, to know that they're people, that they're not gods, that they're not immaculate, they're not, infallible, they're not omniscient, and they're not omnipotent, okay? So, and then I had I knew another guy who was a surgical tech, and he was telling me that he's been a surgical tech for over a decade, but he would say that, like, he'd be in surgery. So I guess surgical techs assist the doctors with operations, but he was basically saying he'd be in surgery and he would have to basically, like, remind doctors to do shit during surgery. Like, they would fuck up all the time. And he'd be like, I think you need to close that. We need to close this wound before. Oh, yeah. Like, I'm like, are you fucking serious? That's very discomforting, don't you think? So, I mean, I feel like people should be rioting over the medical industry. Like, they're the biggest, like, thug-ass gangsta mafia out there. And they've basically taken over the whole world, okay? They've taken over the whole world. The scientific medical dictatorship is basically what's really fucking everything up, right? Because you have a lot of people, too, I have some sympathy. We clown people, and people in the comment section have clowned too. I've clowned people, that are liberals and stuff, especially like, if you look in the lower income neighborhoods. But, if you're being vaccinated at birth, if you are getting, you go to the liquor stores, and everything in the liquor store is basically not just the liquor. I'll talk about the chips, the candy. It's all chemicals. It's all drugs. It's all bad for your brain, and it inflames your brain, okay? Just not, in addition to the alcohol, okay? So, I mean, maybe you can get, some liquor stores might sell an apple or banana, but then that's like GMOs and there's more chemicals. It's like, where are you going to, like, we really have to start growing our own food. I mean, so if you're already having inflamed brains from vaccination, you add to the food, you add to the rap music, you add to the drugs, you add to the PSD trauma with all the gangbangers and stuff in the neighborhood. It's just a cocktail for people to be mentally incapacitated to absorb information and new information, especially when it's being pumped into their head through social media and TV and music and stuff. It's really hard. We need a miracle, And fortunately, there are some people waking up. I do believe that there's a higher spirit, a higher power, but it's just the diabolical, I'm trying to say all these big words, can't pronounce them. The diabolical element, there's a diabolical element to this. It's diabolically evil, because if you really look at it, it is by design, I believe. I don't think it's coincidence. Either these people are really, like, incredibly, amazingly, like, stupid, right? Appallingly stupid, or they're diabolically evil. And I think that there are people at the top. I hate to use the pyramid analogy, but that's just the best visual that I can think of. Or a tree. You can use a tree. Something that's basically thin at the top and then broadens down, right? But the people at the top know. They know. And then you have the people like the doctors and the nurses and the medical, they just follow orders. I think there's some doctors that know. I know a few years ago, there was a guy that went to jail for like 45 years because he was misdiagnosing people with cancer, because oncologists get a straight up percentage of the chemotherapy that they, I don't know if you know this, but they get like a percentage. When they subscribe somebody chemotherapy, they get a huge percentage of that. And it's like millions of dollars, okay? So, yeah, but this guy was just misdiagnosing people with cancer left and right and getting the kickbacks from it. So you can get the kickbacks. And, the chemotherapy was actually killing people and maiming people, and they didn't even have cancer. I'm not a doctor, can't give you medical advice, but if I were you were getting any kind of diagnosis, I would get a second and third opinion before I would determine that's what I have. And I also would go outside of the allopathic medical industry to figure out if that's the only solution for the problem that I have. Because the medical schools are owned by the pharmaceutical industry. The medical journals are owned by the pharmaceutical industry. The media is owned by the pharmaceutical industry. Do you see the game here? There's no way out, okay? If you're in that box of trusting the medical industry, okay? They're the most demonic fucking force on the earth. I thought I was gonna make it through this video without cursing, but I just can't. When I think of the big pharma and the medical industry, I just get so angry. I can't be like, jeepers guys, this really burns my soup. No, fuck those evil motherfuckers. They deserve to burn in hell. And I do feel like a lot of also, I mean, there are many agendas going on, I believe, with this COVID thing, good and bad, right, both sides. But one of the agendas, I believe, is the fact that people are really around the world are questioning the medical industry. There's a lot of, you know, I have friends from all over the world that send me articles and stuff on, you know, people in third world countries pushing back on vaccines. Anytime there's like a hurricane or somewhere in the Philippines or, you know, like somewhere, you know, in third world, but they always rush in to vaccinate them. Why not food and water and shelter? No, it's vaccines first. Like, come on guys, really? Seriously? Okay. So yeah. Anyway, that's my rant for today. What was I gonna say? Join my email list. Join my email list. Please, please, please go to truthortalk.com. Join my email list. I'll do one thing at a time. PayPal me if you wanna donate. Go shop at the store, get your Conspiracy Realist t-shirt and All Lives Matter bumper sticker or your zines, and subscribe to my other channels. And that's it, y'all. I'll talk to you later. Peace, cruise, and love. Bye-bye. Mwah.